I'm here with Dr. Donald Rainey, who is an established researcher in the psychiatry department here at Emory. And he works here in Yerkes and does brain research on affective disorders. So we wanted to get his perspective on this gut microbiome and how it could affect mood in the context of our paper, but realizing that he's not an expert on the microbiome, but more an expert on neurological disorders and their systems. So our first question is, this 4-EPS, or any metabolites that comes from the gut microbiome, you're saying that, or would you say that that can cross the blood-brain barrier?
Yes, because my understanding of the negative side of the microbiome is that they release a lot of inflammatory agents like the cytokines. And the cytokines in the gastrointestinal wall can loosen the barrier against things easily accessing the bloodstream, so it makes the bloodstream more accessible. So anything that is in your gut can potentially then directly access your bloodstream, and if it can access your bloodstream and it's small enough, like the cytokines and things like these are, then it can very readily access the blood, cross the blood-brain barrier and access the brain.
So these metabolites from bacteria or other things in the microbiome, if they're small enough, they can get through. Mm-hmm. And you're also saying that a negatively balanced microbiome with negative acting agents makes the gut leaky.
Leakier,
They can get
Absolutely.
in easier.
Yeah.
Okay. You are a little bit versed in the paper. You had a little bit of time to look over it. What is a possible mechanism, do you think, that this 4-EPS, this metabolite from this bacteria, could have on affecting, producing the affect of an autism spectrum-like disorder? Do you know of a mechanism how neurologically how this could be happening or affecting the brain?
Well, again, I think I would probably come back to inflammatory responses, because things like the challenging pregnant mothers in rats with large molecule lipopolysaccharides that are released by bacteria has been long used as a model to try and induce autism-like behaviors. And it's possible that it's these inflammatory responses and inflammatory invasion into the central nervous system that again could be producing autism spectrum disorders, because these molecules might be capable of inducing cytokine production locally within the CNS. So areas like depression here in Emory, Dr. Andy Miller in psychiatry has been at the forefront of using anti-inflammatory agents to treat depression, and they work very effectively. And this was actually found out from cancer research, where you need to suppress inflammatory responses initially to do cancer treatment, and it turned out that it's started alleviating the depression that the cancer patients had. And initially they didn't know if it was, well, are they feeling better because they think their cancer is going? But then when parallel studies were run, it turns out that you can give depressed people who don't have cancer anti-inflammatories, and they actually show quite a good response. So these again are things that could be produced in the peripheral system, cross into the blood system, cross the blood-brain barrier, and trigger off these inflammatory responses. And we know that areas like the amygdala, which is literally almond in Latin, which is the area that I'm interested in, which is thought to process emotion, has a lot of receptors for things like the interleukins, which are classic inflammatory agents. And so they can directly interact with the neurons in this area that's key for regulating emotion. And so it doesn't have to be necessarily a gut. You tend to think hunger, but there's lots of peptides, ghrelin being the main example, that is released by your stomach wall lining cells and cells in the lining when your stomach is empty, and they're released into the blood system. They cross the blood-brain barrier, and they make you more motivated to go find food. When you eat, the stomach lining expands, ghrelin protection stops. Another peptide, leptin, then is released, and the leptins act as satiety signals that again cross the blood-brain barrier, in this instance working in the hypothalamus, but is regulating food intake. But we all know that when you're hungry, you get cranky, or a lot of people do. And so there's a very logical tie-in between nutrition and affect, emotion. You eat something you like, you feel better. It's for a reason. You want to remember that that was actually more pleasurable than the other thing that you just ate. So the tie-in between the gut and the brain is almost impossible to do. There's an area in the brain, the bed nucleus of the stria terminalis. If you dampen its activity, you can cause massive ulceration in the gastrointestinal tract and in the stomach. It's because it's one of the area that actually responds to peripheral signals of gut disorder. And so if you take that node out of the circuit, you break part of that interaction between, you know, what you think is or what you intuitively know is there, that has to be there, that food is the thing you need all the time or you die. You know, you want to have some investment in good bits and bad bits about dietary intake. And the microbiome plays into regulating some of these systems. You know, it helps us digest, it regulates gut motility and things like that, but it also signals to and from the gut to the brain when there's some dysfunction in the gut.
Right, so a lack of positive bacteria are positive in terms of helping us. Signaling a problem, you're saying, could then go on and create another problem in the brain.
Absolutely.
So in your expert opinion, you would say that all this research linking the microbiome and the gut to mood is relative and valid?
Yeah, very much so. Very much so. I think the use of probiotics is now becoming more and more widespread in clinical practice. And it's because we're getting a better understanding of how much you need to have of this gut microflora for your system to operate normally, both peripherally and centrally.
One more question.
Okay.
This has been great. Do you find it interesting that a human bacterial cell line, B. fragilis, was able to ameliorate some of the symptoms these rodents were experiencing in the paper? Or does that...
Yes, I do. A little bit. Because it makes me wonder... it makes me wonder then of the duration of the effect. Because I don't think you can say that you can cure autism spectrum disorder with probiotics. I don't think that will ever happen. And so I think what these mice have done is that they've set up a compromised system which allows you to say, if this gets compromised, can it contribute to some of the behaviors seen in autism? And gut disorders in autism are huge. They're very, very common. And so there's a potential that they will contribute to it. I think this model basically says if you completely disrupt the system, then you can alleviate some of these behaviors, because potentially the circuit isn't broken. Whereas in autism, true idiopathic autism, kids are often fine up until about age 18 months or 2 years, and then start getting worse. And so the question then for me is there a systems-wide central defect that now in a normally developing brain, because we're not born with a brain ready to do everything that the adult brain does, it slowly develops over a period of time, which is why you know, young kids and adolescents do some really crazy at times. You know,
I never noticed that.
No, I'm sure you haven't. But I mean, this is one of the things. It's like your brain is setting up circuits and memories and things like this to give you your final behavioral outcome. Okay, it's a dynamic system occurring through childhood and into the teen years. Well, you know, I doubt very much that in autism the only thing that's going wrong there is that their gut microflora is wrong. You know, I think there are central deficits which unfortunately are occurring with these kids. It could be partly due to bad microbiome, but then that sets up, say, a central inflammatory response, or a response to cytokines or interleukin and things like this, which then changes the way that the brain develops. And that becomes hardwired, okay? So I think there's an interaction between the two. So yes, the microbiome contributes to some of the disorder, but I think once you get past a certain point, it's there. And you're not coming back from it because it's like you've pulled, you know, some of the connections out that really need to be there. And it's a question of getting in early enough and allowing normal brain development to occur, which is why, say, prophylactically treating kids from families where there seems to be a known link with autism, with probiotics, might be a very interesting way in potentially delaying the onset. But will you ever reverse the onset in idiopathic autism? I don't think so. I think the damage is already done by the time you realise that the kid's got learning deficits. Mm-hmm. So.
No, thank you, Dr. Delaney, for taking time out of your busy schedule to
very welcome,
entertain the interview and questions of a rambling undergrad.